Hello, and welcome to Itentive's webinar on ICD-10. It's back. This is the 5th installment of our webinar series, and we hope you find it as beneficial as the previous ones have been. My name is Chelsea Lukens, and I'm the Marketing Communications Coordinator for Itentive. I would first like to take a moment to explain the process for today's presentation. First, I would like to mention that this webinar will be recorded. Next, I'm pleased to announce that our next webinar will be on January 22nd at 12:30 Eastern Time, and it will be on medical records and minors, navigating parental and patient rights. Finally, I would like to introduce our presenter. Mercedes Moers is a managing consultant for Itentive Healthcare Solutions. She's been a manager in the healthcare industry for over 20 years. She has been a regional director of practice operations and CBO manager. Her roles have included helping practices with a variety of specialties, implementing software, and revising workflow to gain greater efficiency. She has a passion for staying abreast in current industry events and trends, including ICD-10. At the end of the presentation, we will open the floor up to questions from you. We will answer all of the questions at the end, but you may type them in the questions area of the webinar control panel when they occur to you. Finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use that chat box and let us know so we can resolve them. And again, questions may be entered in the questions box. Mercedes, I'm going to go ahead and pass the webinar off to you. Feel free to get started when you're ready.
Thank you, Chelsea. And thank you, everyone, for taking time out of your day to attend this webinar on ICD-10. It's back, and are you ready? The agenda for today's webinar will cover these things. Do I really have to? What is ICD-10? Who does this affect? Why is it important? What do I have to do? And when is it in effect? I keep hearing to get ready, but it keeps being delayed. Do I really have to worry about it this year? I don't want to waste my time preparing for nothing. Well, according to CMS, all Health Insurance Portability and Accountability Act covered entities, which is everything except work comp and auto carriers, must implement the new code sets with dates of service or date of discharge for inpatients that occur on or after October 1st, 2015. HHS has no plans to extend the compliance date for implementation of ICD-10 CM-PCS. Therefore, covered entities should plan to complete the steps required to implement ICD-10 CM-PCS on October 1st, 2015. What is ICD-10? ICD stands for International Classification of Diseases. The 10 is revision 10. It's a code set that was developed by the World Health Organization in the 1970s. ICD-10 is in use in almost every country in the world. The U.S. actually is the only major country in the world that is not already using ICD-10. In fact, the unchanged version of ICD-10 is used in about 110 countries, but for cause of death reporting and statistics only. Only 25 countries use ICD-10 for reimbursement and resource allocation, but the U.S. is the only country that is on a fee-for-service payment system. Some countries have made modifications to the ICD-10 codes, and in fact, the U.S. has permission also to modify the ICD-10 codes to better accommodate their use. So here is a map with some of the major countries, and you can see the dates that they adopted ICD-10. Most of them have been on ICD-10, as you can see, for quite a while now, in the 1990s. China is the most recent country on this map that adopted in 2002, and Dubai most recently adopted ICD-10 in 2012. How does ICD-10 differ from ICD-9? ICD-9 has about 17,500 codes. There are 3 to 5 numeric characters using the numbers 0 through 9 and the letters E or V. ICD-10 has about 70,000 codes consisting of 3 to 7 alpha or numeric characters, and it uses the numbers 0 through 9, but it also uses the letters A through T and V through Z. There is no one-to-one match of codes from ICD-9 to ICD-10 for approximately 80% of the codes. ICD-9 doesn't reflect new services and technologies that CMS has to acknowledge. It is very limited to a maximum of 10,000 codes, and most of those codes have already been assigned. And ICD, and the International Classification of Diseases, it was designed to be updated every 10 years. And we've been using ICD-9 for the past 30, so you can see that we are a little behind in keeping up to date. ICD-10 reflects current knowledge of disease processes. It will encompass more precise documentation of clinical care. It allows more accuracy when determining medical necessity for services rendered. And it will help identify fraudulent activity. The structure of an ICD-10 code. The basic structure of an ICD-10 code is this. The first 1 to 3 characters is the category of the disease. The 4th character is etiology. 5th is the body part affected. The 6th is the severity. And the 7th is a placeholder for the extension of the code to increase the specificity. And here's what it will look like, where you have a letter and 2 numbers, the etiology, the location, the severity, and then the extension. Now here's an ICD-10 code for you. A burn due to water skis on fire. And the code is V91.07XA. So you know with ICD-9, V was always a routine code. Well, not so much anymore, as you can see, because this code starts with a V, and I don't think it's meaning anything routine. At least I don't think water skis on fire is very routine. Who does ICD-10 affect? And a better question would be, who isn't and what isn't affected in your organization? Here is a model of a practice, and as you can see, every area of the practice is affected in numerous ways. And we'll go through a few of these. Your clinicians are affected. Your physicians, mid-level practitioners, therapists, nutritionists, nurses, medical assistants, they all need to know the correct code to choose when documenting their notes. And they all need to know especially how to document. New concepts are captured that did not exist in ICD-9 and must be included in the documentation. That is, concepts such as alcohol level, your Glasgow coma scale, dosing, and blood type. Your coders will need to know which code fits the documentation. Some of them will actually put a diagnosis code on your encounter based off documentation. So they need to understand very well which code to choose. And if they're working your RAC audits, they need to know ICD-10 codes so that you don't end up having to refund CMS all your hard-earned money. There are specific post-operative codes, and using a preoperative diagnosis code post-operatively would be inaccurate. Your office staff and management and reimbursement staff need to understand ICD-10 when reviewing setup of charge codes and analyzing utilization reports. Contracting staff will need to understand ICD-10 when preparing and reviewing contracts with insurance companies. Many, if not all, insurance companies will use specificity to determine reimbursement amounts. Authorization, referral staff, and billing staff will need to understand ICD-10 to ensure patient coverage benefits and accurate payments. Here's another ICD-10 code, S05.90XA, shot in the eye with a BB gun. You will need to understand not only how to choose the correct code, but most importantly, how documentation must change to support the code chosen. For example, obstetric care. Your ICD-9 codes are organized by episode of care. ICD-10 codes are organized by stage of pregnancy. This will impact your documentation and could impact your billing and reimbursement. Coma. Coma is coded 780.01 in ICD-9. ICD-10 codes requires coma be coded based on a coma scale on the Glasgow coma scale. Also must use the 7th character extension how the patient arrived Was it in the field? Was it at arrival in ED? And your documentation must support the code that you choose. So here's another ICD-9 code. Lips stuck to instruments, Y93.J4. Well, I don't know about you, but I'm going to have a hard time memorizing ICD-10 codes. Important steps to take when preparing. Evaluate your contracts. Be especially thorough when examining new insurance contracts. Watch for payment adjustments for broader ranges of diagnosis codes. Contracts which include pay for performance based on ICD-9 codes need to be modified to include your ICD-10 codes. Analyze your system needs. Is your electronic medical record and your practice management software up to date? Can it support dual coding? Can you send out some claims with an ICD-9 code for those carriers, your work comp and auto carriers that may not use ICD-10? Can you still send them ICD-9 and then send ICD-10 to everyone else? Is there a built-in crosswalk from ICD-9 to ICD-10 to help your physicians and your clinicians pick the appropriate code without looking through all 70,000 of them? What build needs to occur in your EHR? What build needs to occur in your practice management software? Who will do the build and when are they going to be able to do it? Contact your vendors to determine their readiness, your clearinghouses and insurance carriers. You want to find out, are they already able to accept ICD-10 codes? Could you do testing with them? If not, when will they be able to? Contact your labs. They will also be getting ICD-10 codes on your requisitions. Are they ready now? When will they be ready? What will they do with your requisitions that have ICD-9 codes on them after October 1st? And it's a date of service after October 1st. Contact your eligibility vendor to find out if they will be able to handle ICD-10 codes for pre-certification and authorization. Practice management and EHR vendors need to be contacted. What do you need to do in your systems to make sure that you can have ICD-10 codes on your encounters and go out on your claims? You have to do internal testing. Test your own systems, your own interfaces. Test your own people. Perform dry runs to make sure everyone knows exactly what they need to do. And check accuracy and specificity. So have your coders look at documentation from a provider and look at the diagnosis code chosen. Does the documentation justify the diagnosis code? Because with the specificity of the diagnosis code, everything that the diagnosis code says has to be in the documentation. External testing. Test your clearinghouse. Send ICD-10 codes to your clearinghouse. Ask your clearinghouse if they will test with the payers. Test your direct payers. If you send directly to Medicare or directly to Blue Cross, test with them directly. Test your eligibility company. Test any vendor to whom you send a diagnosis. And of course, you need to train, and train again. All of those people that were affected by the ICD-10 change, you need to train them all. Are NextGen and Itentive ready? You bet. And we can help you. NextGen has a large number of white papers and utility guides to help with implementing ICD-10. We'll go over just a couple of these here. The white paper, Importing and Mapping ICD Codes version 5.8, you can download from the Knowledge Exchange. At the end of the presentation, you will have my contact information, and if you would like me to email the white paper to you, I would be happy to do that. This white paper includes information and instructions for the steps involved in setting up ICD-10 codes and your general equivalency mappings, your GEMs, and file maintenance in version 5.8. The ICD-9 ICD-10 comparison utility is a testing and educational tool to familiarize us with the mapping of ICD-10 codes for commonly used ICD-9 codes. It will automatically or manually modify your 837 claim file containing ICD-9 codes, and it generates an 837 claim file containing ICD-10 codes independent of the EHR or practice management system. And this allows you to check the financial impact of your ICD-10 can be analyzed in a controlled sandbox environment for testing and code education. Your Clinical Data Loader Utility Guide, version 5.8, you can download from the Exchange. And again, this is another PDF that I would be happy to email to you if you would like. The Clinical Data Loader Utility that you download from the Knowledge Exchange, you need to register and do that yourself from the NextGen Knowledge Exchange. I can't actually send that to you. NextGen steps to implementation. The first requirement is that you be on version 5.8 and KBM version 8.3 as a minimum. And there are two prerequisites, that you run the ICD-9 decimalization and you run the Clinical Data Loader Utility. After that, here are the next 5 important steps. Step 1 is import your ICD-9 and ICD-10 codes into the ICD-CM code master file. Step 2 is to import your ICD-9 and ICD-10 codes from the ICD-CM code master file into the diagnosis code library. Step 3 is to import those GEMs into the diagnosis code library, your general equivalency mapping. Step 4 is you're going to set up your payers. So your HIPAA non-covered entities, your work comp and auto insurance, you want to set up those payers to use the general equivalency mapping. Step 5 is to modify your templates. Any template with hard-coded diagnosis needs to be modified so it will have your ICD-10 code in it. And once you get through all of that, you're ready to go live with ICD-10 October 1st, 2015. Here's another interesting code. Grandma got run over by a reindeer, and that code is V06.00XA. And then here are the top 8 zaniest codes. A really kind of funny code is sucked into a jet engine, V97.33XD. And there is actually sucked into jet engine subsequent encounter, which will use the V97.33XD as well. And I'm not sure how you could really have a primary encounter, let alone a subsequent encounter, but if you do, you have the diagnosis there for it. And your providers will be asking, I hear there's a new ICD-10 code for carpal tunnel syndrome caused by clicking too many times in an EMR system. I don't have the code for that, but I bet it's out there. All right, are there any questions?
Again, you can type your questions in the questions box on the GoToWebinar control panel. While we wait for you to write those down, I just wanted to remind you again that our next webinar will be on January 22nd, 12:30 Eastern Time. It'll be about a half hour long this time. And it'll be on medical records and minors, navigating parental and patient rights. Mercedes, while we wait for people to enter their questions, do you have anything else to add on ICD-10 off the top of your head?
Good. I want to wish everybody good luck, and I know it's probably a subject that you're a little tired of hearing about, and like I said, I actually hope that we can get it over with October 1st of 2015. But we are certainly more than happy to help you if you do have any questions whatsoever, whether you're on NextGen or not.
And again, if you want us to send you the white papers, you can either email any of the people up on the slide here, and we'd be happy to do so. Otherwise, I see a couple of people who put their email address in the questions box, and we'll be sure to send them to you as well.
Yes,
Great.
and this is Cindy. I think, Chelsea, you directed a question at me about will we be doing something similar for the NextGen clinical setup? We will.
Perfect. We got another question coming in here. Do I really have to be on 8.3?
Mercedes, if it's okay, again, this is Cindy, I'll take this one just simply because the official next-gen stance is that, yes, you do have to be on 8.3 to do this. However, depending upon your sophistication in your group, there may be opportunities if you have heavily customized templates or templates that have been customized. There may be opportunities to be able to tweak your templates to incorporate the ICD-10s. That's really a pretty big challenge, and it would require a great level of sophistication. So unfortunately, the real position is that you must be on 8.3. However, everybody can usually find ways around that, and that would be something if you wanted to reach out specifically we could talk about.
Looks like we got a few more coming through here. Is there any chance that it's going to be extended again? Who wants to take that one?
Mercedes, I'll leave that one to you.
Yeah. Well, there is always the chance that it will be extended, but CMS is definitely pushing to not extend it past October of 2015. And I'll tell you, one of the reasons is because some of the other countries are already going to ICD-11. And at that rate, if we keep extending it, we'll miss ICD-10 altogether, which, I don't know, maybe some people think that that would be a fine idea and just move to 11. But, yeah, and every time we look up to see, okay, what are the odds of it being extended, they keep saying they have no intention of extending it.
Peter, I see your question here. Is there a way that we can get a copy of the PowerPoint you just presented? Yeah, we'd be happy to send you that. And we're also going to be putting a recorded version of this webinar onto our YouTube channel as well. So feel free to check it out there. We have a number of the ones that we've done in the past there if you want to peruse through what we have. And you can always keep up with us on Facebook and Twitter as to any new ones that we're adding out to it. We got another question here. What about claims that are not submitted by October 1st, 2015, but the date of service is before then? Will they still be accepted with ICD-9 codes?
Yes. Yes. It goes by date of service.
Go ahead.
It goes by date of service.
Correct. Okay, well, if you have any more questions, please feel free to type them in or email or call any of us on that screen there, and we'd be happy to help you out. Otherwise, thank you for joining us today, and hope you have a wonderful, wonderful remainder of your day. We'll hang on for a few more minutes just in case any more come through.
Thank you, everyone.
Thank you. Okay, well, let's finish up here. And again, feel free to reach out to us, email us, call us. We'd be happy to help you out with any questions you have. Thank you, and have a great day.
Thank you, Chelsea.